Hello everyone, my name is Dr. Kasmi, and today I'm here to talk about very frequently asked question, that is, what is ALS, how do we need to book ALS, and everything related to ALS. So let's dive right into it. What is ALS? ALS stands for Advanced Life Support. So ALS basically teaches you a certain sequence of steps that you need to go through and how to perform those life saving steps, okay, in any kind of condition, whether there's a collapsed patient or an unstable patient as well. So how do you identify certain things, what are the next steps that you take? So it is something which teaches you how to save a life in simple words. Who can give ALS? So anybody can give ALS, whether you are a medical student, whether you are a nurse, whether you are a doctor, you're a specialist, junior doctor, even paramedics now do ALS. So every person who is involved in dealing with a patient or dealing with another life can give ALS. When should you give your ALS? So ALS can be given at any time. There is no fixed criteria for that. So ALS always looks good on the CV. So if you're somebody who is applying for a job, you can do ALS before applying for that job. Otherwise, there is no fixed timing, no right or wrong when it comes to giving ALS. It is always better to do it as soon as you can, because then you can save many lives. As for IMGs, the best time for them would be when they have booked their PLAB 2 exam and they're coming to the UK, so then they can book their ALS course, and after they're done with their PLAB 2 exam, they can also complete their ALS course. How to book ALS? To book ALS, you should go to UK Resuscitation Council website, and I will be sharing the link for this website under this video in the description box. And that is the most valid and the most correct place to go to book this exam, not a training center and nowhere else, because we know the credentials of this website. So once you go to this website, they will give you different options. You will have options like different dates and then different locations. So you can actually select your area, and then you can select how many kilometers away or within what radius you would like to book your exam. Let's say if I'm living in London, I'm going to choose, let's say, within 10 minutes radius of my location. Then I will get information of all the registered training centers within that area, and then I can easily go and book my exam. What happens after you have booked your exam? So right after you book your exam, you will receive a confirmation email. And after 3 to 4 days, sometimes it can take up to 5 days, you will receive your manual, which is basically your main resource to learn about this course. You will also receive details about your main center, and that center will also have each and everything that you need to know about it, including the location, the prerequisites, if any required, and the documents that you need to bring along with you on that day. In the initial confirmation email, you will also see that the UK Resuscitation Council will send you a link to the LMS. So once you log into that, you're going to change the initial password, put your own password over there, and then you can easily view your training course. After you click your training course, you will see a number of core modules or starter modules. These are the different chapters that you need to complete before you go and appear in your exam. Now, there are two types of ALS, EALS and Simple ALS. So, what is the difference? EALS basically is for those people who are not able to attend the course for 2 days. So, EALS is a 1 day on site course with a lot of online learning, whereas Simple ALS is a 2 day on site course with less online learning. If you applied for ELS, you will receive a number of core and starter modules which will be extensive, and you need to complete them before you appear for your exam. That will also be for just 1 day, But remember that you will be taught before the actual exam where you have to do the MCQs and also perform. Now for ALS, the module that you get, it will be very short. It might have 3 to 4 chapters in it, but you still have to complete that. And then you have to go for 2 consecutive days to your training site. But again, they will teach you in detail each and everything. So what I mean to say is that for both EALS and ALS, there is no difference in the curriculum or the training that you will get. But when you get your final certificate, there will be no difference. EALS or ALS does not have any difference on the certificate. So, how to prepare for the exam? For the exam, you need to prepare for the theory. So, you will have MCQs and you also need to prepare for the practical part. For the theory, you need to go through the book that they will be giving you, which is the manual, which I have right here with me. This was my manual, and this is a very extensive book. As you can see, it is not a 10, 20, 15 page manual. It is a book with 17 chapters, so you need to have ample time so you can read this in detail and understand what it is trying to say. Once you are reading this, it is best to highlight all the important points or underline them, whichever point you feel like can come as an MCQ. So these can be different values, different ECG findings, different leadership skills that will be involved. So just go through this very, very thoroughly. It has different chapters given inside it. So if we see right here, it has different chapters given inside, and they have a lot of different cases, like you can perform CPR during drowning, after a drowning case, in hyperkalemia, hypokalemia, in sepsis, in pregnancy, anaphylaxis. So there are so many different cases here, and it is important that you go through each and every case. So this is your main learning resource when it will come to solving the MCQs. For the practical part, a tip that I would give you is something one of my friends told me, and that is, if you are somebody who has just cleared their PLAB 2 exam, try to revise your SIMEN cases. So, the SIMEN cases are all the acute emergency cases that you can encounter, and those are the cases which can actually require ALS protocol or ALS algorithm to be applied to them. Otherwise, another great tip that I can give you is, which I discovered, that behind your ALS book, like just on the last page, you will see that they have given you some recommendations for the different types of apps that will be helpful for you. So if I read here, there is the iResus app, then the Lifesaver and Lifesaver VR apps, and then eLifesaver as well. So there are a number of apps which you can actually download on your phone and practice on them as a simulation. I will be sharing all the important link to some practice questions as well right below this video in the description box. So what to expect on the exam day? The thing that you will encounter on the exam day will be different for everybody else depending on their clinical training center. I reached that around 8 a.m. in the morning, and then I was greeted at the reception. They checked my passport, so it is very important to take that with you. And then they asked me to go into a waiting room. So then you are just waiting with all the other candidates. During that time, you can enjoy some coffee, drink water, try to bring down your anxiety levels lower if you're a bit anxious. And they will also have some biscuits and some sweets as well for you, so you can enjoy that. And then they will take you all into another room where they will give you a brief overview of what will be taught during the day, and you will meet your different simulators and examiners as well. So it's a very healthy environment, and it's best if you try to be interactive. So I took EALS, which is a 1 day on-site course with a lot of online learning available, and we had 2 breaks as well in between. And after 4 p.m., we had our MCQ tests, and we had around 120 MCQs, if I can recall. and then there were different options which were true and false, and these were exactly based on the pattern which was there in the pre-course MCQ that you had to attempt with your online module. So it's best to actually practice as much as you can, because the real exam will be almost similar to the one which is there online. Definitely the questions will change, the ECGs that will be given will change, but the pattern will be the same. Try to get as many questions right as you can, because the passing mark are 75%. And if you do not clear the practical part but you have done well in the MCQ part, you can still get another chance. But if you did bad on the MCQ part, you will fail the exam. This brings us to the end of this video. I hope that you found this video really helpful. If you have any questions, please put them below in the comment section, and I will try to reply to as many as I can. And best of luck for your ALS exam. Thank you.